March 8, 2024 was International Women's Day. Globally, March has been declared the month of the woman, specifically to celebrate the achievements of women and draw attention to their issues. Women have progressed from the gender roles of cooking, cleaning, and raising children to the ability to work, earn equitable income, vote, own property, be educated, and participate in politics. But there's still much to be done. And I'd like to highlight a very disturbing topic: gender-based violence. Statistics from the GBV Data Situation Room estimate that 35% of women, with 1 in 3 Nigerian females, experience violence at some point in their lives, mostly by an intimate partner. 6 states, Adamawa, Lagos, Sokoto, Cross River, Ebonyi, and the FCT, recorded 27,698 cases of sexual and gender-based violence between 2020 and 2023. 1,145 of them were fatalities. Let me make you understand that better. At least 4 out of every 100 gender-based violence ended up with the woman dying. Last year, December, Invictus Africa published the Womanity Index, which is an annual assessment and ranking of subnationals based on their performance to prevent and respond to GBV. As per indicators spread over 5 indexes: law and policy, access to legal justice, support services, information and awareness, and budget and spending. Each subnational was ranked on a 4-color code: blue the highest, followed by green, then amber, and the last being red. Of the 36 states plus the FCT, only Lagos State achieved the blue ranking. 5 states had the green ranking: Ogun, Ekiti, Edo, Delta, and Akwa Ibom. 23 states, including the FCT, were amber, while 8 states were in the red, all of them in the northern part of the country. Yes, I know what you are thinking. That picture doesn't look good. But for states to move from red to amber to green and blue, they need to do a couple of things. Number 1, they need to implement laws and policies that strengthen prevention and response to GBV, including criminalizing negative customary laws and harmful sociocultural norms and practices. Number 2, they need to make access to legal justice easier for victims through non-bureaucratic GBV prosecution process, enforcement of court judgments, publication and updating of sex offenders register. Number 3, we must have holistic and effective support services for GBV survivors in place through shelters like the Sexual Assault Referral Centers called SACs that are accessible. Number 4, there must be constant provision and dissemination of simple information, education, and communication materials about GBV, such that it is user-friendly, in people's language, and accessible to all. And number 5, budget allocation and spending on GBV prevention and response, including specific GBV budget lines in the state budget, must be in place. This advocacy concerns us all. While the government must do its bit, the biggest part has to do with every one of us. We must elevate our values and preserve and respect the biggest gift to mankind, humanity, so that our daughters, our sisters, wives, mothers, and every woman is protected from gender-based violence.